Thank you for opening the video. Smile Trouble Consultation Room. Have you ever wanted to go to the Matarai when you were nervous about work, an exam at school, an important sports day, or when you heard something that made you feel anxious? I think this is common in today's stressful society. People who experience symptoms such as diarrhea due to mental stress or an imbalance in the autonomic nervous system may have irritable bowel syndrome. It is necessary to collect information on the correct treatment in order to take prompt action. We will also explain in detail the real causes of irritable bowel syndrome, so please watch until the end. Irritable bowel syndrome is a condition in which mental stress and an imbalance in the autonomic nervous system affect intestinal function, resulting in symptoms such as constipation and diarrhea. The appearance of defecation abnormalities differs from person to person. Some people have continuous diarrhea, while others have alternating constipation and diarrhea every few days. Symptoms of irritable bowel syndrome are not uncommon. Irritable bowel syndrome is also characterized by the fact that no organic abnormalities are found in the intestines even when examined. As a result, many people suffer alone because the people around them do not understand how painful they are. Irritable bowel syndrome causes symptoms such as abdominal pain and bloating, as well as diarrhea and constipation. It can be divided into three types: diarrhea type, constipation type, and mixed type. Diarrhea type diarrhea is characterized by abdominal pain and a strong urge to defecate due to triggers such as stress or tension, and symptoms tend to appear when you are unable to go to the toilet while commuting to work or school. The constipation type causes symptoms such as bloating in the stomach due to constipation. The mixed type is characterized by alternating episodes of constipation and diarrhea. Irritable bowel syndrome is suspected if these symptoms persist for more than 3 months. Symptoms appear when you are stressed or tired, but they are less likely to appear when you are sleeping or on your day off. If the symptoms occur frequently, the diarrhea can interfere with daily life, making it impossible to ride the train or go out. In order to improve the symptoms of irritable bowel syndrome, it is important to maintain a regular lifestyle that avoids stress and fatigue. In the case of mild symptoms, there are many cases where the patient does not receive treatment, but rather monitors the progress while making lifestyle improvements. If the symptoms do not improve despite lifestyle changes, or if the symptoms are severe, drug therapy is performed to alleviate each symptom. Symptoms of irritable bowel syndrome often appear due to mental stress, so antidepressants and psychotropic drugs may be used if the patient is feeling depressed. Additionally, if the psychological symptoms do not subside with drug therapy, psychotherapy such as counseling is often required. The brain and intestines are so closely related to each other that it is said to be a brain-gut relationship. When living things feel stressed, their brain conveys the stress stimulus to their intestines, causing them to have a bowel movement. Therefore, we need to think about the mechanism by which information is exchanged between the brain and intestines, and the importance of the nerves that play a role in communicating with each other. If the sympathetic nervous system continues to dominate due to stress, the brain determines that it will be a burden on the body, and as a self-defense response, it switches on the parasympathetic nervous system and instructs the intestines to perform excessive peristaltic movements. When you let it out, it means you want to go to the bathroom. The exact mechanism behind the onset of irritable bowel syndrome has not yet been elucidated. The current view is that abnormalities in the brain-gut relationship are involved in the onset of irritable bowel syndrome. For example, the autonomic nerves distributed in the gastrointestinal tract include sympathetic and parasympathetic nerves. The sympathetic nervous system has the function of suppressing intestinal movement, and the parasympathetic nervous system has the function of activating intestinal movement. The sympathetic and parasympathetic nerves each regulate intestinal movement while maintaining a balance with each other, but if the balance is disrupted due to stress or fatigue, intestinal movement becomes abnormal, which can easily cause diarrhea or constipation. It is also thought that the sensory nerves that sense intestinal pain become more sensitive, making it easier to feel abdominal pain and tension. Therefore, when considering the true cause, it is important to focus on the hypothalamus in the brainstem, which is the center of the autonomic nervous system. The hypothalamus is located in the diencephalon, an area of the brainstem that surrounds the third ventricle. The hypothalamus is the center of autonomic nervous functions that are important for life activities, such as respiratory rate, blood pressure, heart rate, digestive juice secretion control, body temperature control center, feeding control center, drinking water control center, and emotional behavior center. For example, in the case of the stomach, when food reaches the stomach sends a message to the hypothalamus in the brainstem saying, "I have this much food right now." And then the hypothalamus in the brainstem sends a message to the stomach saying, "Okay, now I have this much food, get rid of stomach acid," he gives the command. I believe that if the nerves that communicate with each other are not able to communicate properly for some reason, they may issue a command to produce more stomach acid than necessary in relation to the amount of food eaten, causing a disruption in coordination. Masu. There are certain parts of the body that can disrupt this nerve transmission. It's the neck. Irritable bowel syndrome is a condition in which mental stress and an imbalance in the autonomic nervous system affect intestinal function, resulting in symptoms such as constipation and diarrhea. The brain and intestines are so closely related to each other that it is said to be a brain-gut relationship. By improving communication between the hypothalamus and the brainstem, which issues instructions for intestinal function, and the nerves that connect the intestines, symptoms of irritable bowel syndrome will also improve. The real cause is the neck. Proper treatment for the neck will normalize the function of the hypothalamus and the brainstem, normalize nerve transmission, and improve symptoms of irritable bowel syndrome. If you would like to learn more about the cause of irritable bowel syndrome in your neck, or find out information about the correct treatment for your neck to improve your irritable bowel syndrome, please click on the URL of the Smile Consultation Room homepage in the Overview section. Please. There is no consultation fee. We look forward to your call. Thank you for watching the video.